I'm here now with Michelle Riordan-Nold, who is Executive Director of the Connecticut Data Collaborative. Michelle, great to see you.
Good to see you too.
So I understand that you spend most of your career analyzing numbers, and you do that as part of the Connecticut Data Collaborative. What is the mission of the collaborative?
Sure. So the mission of the Data Collaborative, we're seeking to build an ecosystem of data users across the state by democratizing access to public data and building data literacy skills. So we describe our work in 4 ways. We make public data accessible through our website, ctdata.org. And we stress accessibility, not just availability, because we have visualization tools that allow users to easily find the data and understand the data they're looking at. We also help liberate data. We work on projects with state agencies or other nonprofits and help make their data accessible to the public. So we work with the Secretary of State to make business registration data available to the public. We are the designated state data center, so we are the liaison between the Census Bureau and the public in helping to understand and use census data. And then we also have what we call a Connecticut Data Academy, and that's where we focus on building data literacy skills. So we realized in our work that we could put a lot of data out into the public, but it doesn't necessarily mean people know how to use it. So we have public data education workshops that we hold across the state. Some are free. Some are, for a small fee, and we teach people how to use data and hopefully use it to make an impact.
Okay, and you also have a nursing portal.
We do. That's our newest endeavor.
Okay, why build that?
Well, I was approached by Marcia Proto of the Connecticut League for Nursing and Lisa Sundin about 5 years ago. We began this journey. And they saw the value in having nursing data all in one place with the data that we have on our site, so that people could look at, okay, what they could understand nursing supply. So where are nurses? Where do they work? Where do they live? Who are they? They could take a look at nursing education data and see, what's the pipeline. Who are the faculty, and then also demand data. What are our employers demanding in terms of nursing workforce? But they were also interested in having it combined with the other public data that we have on our site. So, where are our nurses working and living, and what are the public health issues that are happening across the state, and combining that data and trying to understand how can we influence public policy change, or how can we have an impact and make change for the good? So we worked to make the education data, gather the education data, also gather the supply data, and demand is coming next year. We built a site called nursing.ctdata.org where users can go and access all the data, see visualizations of the data, and then it lives on our website where we have other public data.
Okay. Aside from policymakers and leaders of organizations, who else might want to visit this portal, and how can they use the information they get from it? People broadly, right? So I would think policymakers being both people working within individual state agencies or legislators or the governor, and also workforce boards who are trying to align nursing workforce demands with programs and opportunities, with nursing being one program or opportunity for people to focus their career on. I also think the healthcare ecosystem would be interested in these data, right? Because we're combining education, supply, and demand all in one place, and you can see the trends. So the audience and nurses themselves, right? If they're looking to see, okay, where are the opportunities? Where is the demand for jobs? Maybe if they're looking to, extend their career, they could see where the demand is, or they could see where opportunities are. So it's a really broad audience who could use the data. What sort of information will you be sharing, or takeaways will you be sharing with the audience today?
that's attending the summit?
Yeah, so the site was made live this morning, so no one in the audience has seen it yet. So I will be sharing what you can find on the site and sort of explain the journey of how we got here, and talk about the future potential of finally being able to understand the nursing workforce, or I mean, people have understood it before, but having a place to go, right, to access the data, which is often the hard part. Is where there's so much data out there. Where do you go to find it? But to have it all in one place is really makes it useful for folks.
Is the portal ever finished, or do you continue to update it and to change it to address different needs?
Yeah, it will be something that will have to be updated as more, and we've talked about trying to implement a schedule in terms of how often does the supply data need to be updated, how often does the education data need to be updated, and the demand data. So it's a living, breathing site that will constantly need to be updated. And as as people, policymakers, decision makers, want to address issues, maybe they're public health issues. For example, someone approached us to take a look at opioid deaths and where nurses are working and living. So we combine those two data sets together. So if we get those types of questions, we can then answer those questions and provide the data on our site, not just for the person asking it, but for the general public too.
Okay, Michelle Riordan-Nold, thank you so much for your time.
Thank you.